Hi friends, this video is going to be on Gabica. Gabica has 75 milligrams of Pregabalin in it. It's made by Getz Pharma. The box has 14 capsules in it and the price for one box is 350 rupees. Pregabalin capsules or oral solution or extended release tablets are used to relieve neuropathic pain from damaged nerves that can occur in your arms, hands, fingers, legs, feet or toes if you have diabetes or post-therapeutic neuralgia, which is burning, stabbing pain or aches that may last for months or years after an attack of shingles. Pregabalin capsules and oral solution are also used to relieve neuropathic pain that can occur after a spinal cord injury and to treat fibromyalgia, a long-lasting condition that may cause pain, muscle stiffness and tenderness, tiredness and difficulty falling asleep or staying asleep. Pregabalin capsules and oral solution are used along with other medications to treat certain types of seizures in adults and children 1 month of age and older. Pregabalin is in a class of medications called anticonvulsants. It works by decreasing the number of pain signals that are sent out by damaged nerves in the body. Pregabalin comes as a capsule or an oral solution or an extended release tablet. Pregabalin capsules and oral solution are usually taken with or without food 2 or 3 times a day. Pregabalin extended release tablets are usually taken once daily after an evening. Pregabalin extended release tablets are usually taken once daily after an evening meal. Take Pregabalin at around the same times every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Swallow the extended release tablets whole. Do not cut, chew or crush them. Your doctor will probably start you on a low dose of Pregabalin and may gradually increase your dose during the first week of treatment. Take Pregabalin exactly as directed. Pregabalin may be habit forming. Do not take a larger dose. Take it more often or take it for a longer period of time than prescribed by your doctor. Pregabalin may help control your symptoms but will not cure your condition. It may take several weeks or longer before you feel the full benefit of Pregabalin. Continue to take Pregabalin even if you feel well. Do not stop taking Pregabalin without talking to your doctor, even if you experience some side effects such as unusual changes in behavior or mood. If you suddenly stop taking Pregabalin, you may experience withdrawal symptoms including trouble falling asleep or staying asleep, nausea, diarrhea, headaches or seizures. Your doctor will probably decrease your dose gradually over at least 1 week. Some side effects of this medication include tiredness, dizziness, headache, dry mouth, nausea, vomiting, constipation, gas, bloating, speech problems, difficulty concentrating or paying attention, difficulty remembering or forgetfulness, anxiety, lack of coordination, etc. Pregabalin may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. I hope you like the video. Please like and subscribe to our channel. Thank you.